everybody. State Representative Ken Clark, District 24, with your Monday Moment. Today we're going to talk a little bit about hemophilia as it pertains to the state budget, and you might learn a little bit of something you might not have already known about hemophilia. To my right here is David Cabrera. He's going to tell you a little bit about how hemophilia affects him as a patient.
Hi, my name is David. I am a severe hemophiliac, and I got some examples of some needs that a person with hemophilia might have. So this is when someone gets injured and has a bleed, and then it swells up around your joint, but you would still be able to move it. This is a second stage where it's starting to get worse. The cartilage is going out, and it's starting to go beyond bone on bone. So it's going to be harder and more painful. And then this is the last stage where the cartilage is completely gone and it's bone on bone, and swelling is gone, so you won't be able to see any swelling out from the outside because all the blood went inside. And as you can see, you can't really move it, and it's extremely painful, and it'll just keep getting worse. It'll just prolong, keep bleeding into it, and just vicious cycle, just the same.
So David, this is what happens if you can't get your medication.
Right.
Okay, so here to talk about medication is Brent Devila, who is going to tell us a little bit about that.
Hi, nice to meet you. I also have severe hemophilia A, and this is the medication that David and I need to take in order to prevent that permanent joint damage. This is a single dose, and it costs $3,800. Now, it seems like a lot, and it especially is when you consider that we have to take it every other day for the rest of our lives. It comes out to about $700,000 a year, which is a problem for a lot of patients with bleeding disorders. They don't have a lot of options. And if they, decide to go off, or if they need to get treatment, they go to an emergency room if they don't have any coverage. So we try and make sure that they have some kind of coverage, especially even if it's through state coverage, because that ends up costing far less in the long run than if a patient went to get emergency treatment.
And so this brings us back to the budget. The last budget that the governor and the Republican leadership passed out of here is trying to cut access payments for any treatments at all to 5 years. Hemophilia does not go away in 5 years. We have to think about that. We have to talk about that. It's something that we didn't talk about much during the budget process. So we hope that you can stay involved and have a look at their website. It's behind me. And join us also at azhousedemocrats.com to see what else is coming up. Thanks.